Okay. Someone asked about materials and the downloading of materials. Those will be available, any of them, until the very last day of April. So basically a month from now. We are condensing obviously a lot of it into short, digestible, searchable info. I've really been sitting even the past few days over what that will look like even more. What I'm really leaning towards, and y'all know this, but no one else will, is an app that's downloadable from the App Store. It will also be compliant with a website for those who don't have access to that. And the app will be free. Anybody can access the app, and the free app will have kind of the basic things we talk about: habit building, stress reduction, blood sugar tracking, all that information. And then I think we're going to structure it with a cheap, cost-effective membership fee of $7 a month for tier 1. This is all just like TBD. The second tier will have additional information, and we're going to have categories like hormones, autism, autoimmunity, all these things. And then tier 3, we're thinking will be a way, and this will not apply to y'all, so I wanted to make this clear, but tier 3 will be where people can order labs through a storefront. Those will be priced higher. So y'all will still go through us and practice better because it's basically our cost. So that's the only difference between you guys who've been a part of our RCF program and kind of what is ahead with this. But anyways, just wanted to update y'all on what's next. And I also wanted to share that because with an app, not sure if we are going to have everything ready come May 1st. So what we're probably going to do is have some other place to like house this group and put the bulk of information in like a Google Drive. So that's sort of what we're leaning towards right at the moment, because I don't know how long it's going to take us to build out this app platform, but that'll still include our monthly calls, Q&As, case studies, all that. Do you have any questions about that? None of this is set in stone, but it's kind of what we're leaning towards at the moment. But if you have any questions, just let us know. Okay, so we are going to dive in to today's topic: stomach, intestines, bladder. So both large and small. And then I'm also going to, probably at the beginning, before I get to bladder, share with you guys 2 URLs. One's a video, and one is sort of a breakdown of different bladder things, because there's a lot, like interstitial cystitis, incontinence, overactive bladder, OAB. So lots of possibilities there. Okay, diving in. Here we go.
Hi guys, sorry I'm late.
All good. I'm about to dive in.
Okay, go for it.
And it's already recording, so we're good to go.
Perfect.
Okay, so looking at this is what we'll kind of start with. And I think it would be cool if y'all could even take note or journal, because this slide alone is a massive influence on the organs we're about to cover. Massive, 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 massive influence. So when we think of our emotions, and we've talked about this in the past, and this is sort of like the traditional Chinese medicine route, but take that part out of it. Really think about how your body responds in circumstances, situations, various triggers, and how you feel as a result. So think about just how the body will respond when someone gets really scared. They'll pee their pants, right? Like, oh my gosh, like I just almost got, whatever, and I just peed my pants. And then think about also how exhaustion can play a role in even our urinary habits, inadequacy, fear. So that's bladder. That's kind of the big key things there. Stomach, we've talked about this in the past with kiddos, and when they're worried, they'll sometimes say like, hey, I have a stomach ache, I don't feel that great. But self-worth and discouragement can also influence that stomach. And then when we think of the colon or the GI tract, that small intestine and large intestine, the small intestine can be anxiety, depression, loneliness, jealousy, kind of housed in that area. And then large intestine, think about it being deeper, right? What is the root of that anxiety and depression and jealousy? Often it's these deeper rooted things, which the large intestine is deeper than the small intestine: grief, hurt, regret, judging, shame. And our body remembers. Our body, that book, Our Body Keeps the Score, Not to say that there isn't a way and an availability to heal from these things, but often we have to go back. We have to go back in our history and figure out what created these responses. And so if I was going through this and I saw this for the first time, I know for me, my stomach and my intestines have been a wreck in my life, in my past, of sitting down and writing the word worry down on a piece of paper. I do this often, like especially in my quiet time. Or if I feel anxious in a situation, I'll write anxious at the top and I'll write down what triggered this. Why was it triggered? What in my past is similar to this? What were things that influenced this emotion as a child? So think about even how the stomach relates to food. When we're worried, what do we tend to do? Eat food. When we have self-worth, what do we tend to do? Eat food. When we're discouraged, what do we tend to do? Eat food. You even see it in movies. You're going through a breakup, or the character's going through a breakup, and all of a sudden they see them with like the mascara down their face and like eating a ton of ice cream, right? So it's portrayed even in that light as well. And then once you can go through that list of writing it all down, recognition is the first step. It's then replacing it, right? So if we're giving a real life example, let me think of one. If you had an absent parent growing up, you may feel inadequate. You may feel like, and this was my past, right? You feel like I need to be better in order for a parent to be present. And so because of that inadequacy, I've now accepted the lie that ongoing in my life, I'm not going to be good enough for someone to stay. I'm not going to be good enough for someone to be present. So then you adopt these ideas of like low self-worth and discouragement, and it impacts your digestion and your stomach. And it leads to things like anxiety of chasing perfection and striving. And then you pull yourself into loneliness out of fear of getting hurt, right? So you see how all of these things are connected. And then I invite the Lord in to heal and mend those and repent of the lies I believe due to a circumstance or situation. So forgiveness is going to be a big part of this, and recognition is going to be a big part. So I would just sit with that, especially if you're reading these and you're like, yes, that resonates with me. We'll come back to the emotional part when we get to the bladder, because that's a big organ that's impacted. So Allie kind of gathered all of these great pictures to show you guys what happens with digestion as far as the stomach and the intestines go. I'm not going to break down all of these different words, but it is a pretty complex organ when you think of it. And you look at even the shape and the role and the body of it, and the esophagus that's connected at the top. And then you have the duodenum, which is sort of near the bottom, with the pyloric sphincter, which we reference often, that can open and close and influence acid reflux. And the stomach needs a very specific pH to keep that sphincter in the right way and not open and close, both in the esophageal side and the duodenum side. And then you also have different layers of the stomach. You have the oblique layer, the circular layer, and the longitudinal layer. And then from there, you have the serosa and the mucosa, and then the different curvatures. There's also the pylorus and the gastric rugae of the stomach as well. So lots of components to the stomach. Here's just another little description of each part of it, just so y'all have that slide. And then this was a quote from the NTA that Allie found, that digestion is the mechanical and chemical breakdown of food. The goal of digestion is to reduce food to molecules so small that the nutrients can be absorbed and used by the cells. Essentially, your stomach is the storage tank for food so that the body has time to digest it properly. So think of it as like the churner and the grinder. When you think of a meat grinder, that's the stomach. It's grinding and mixing it to a really small form. Or think about a grain grinder or a coffee grinder. It is creating it into tiny little molecules so that it can pass through efficiently without causing problems. You would not put whole beans in a coffee grinder and coffee maker. You're not going to get adequate coffee out of that. And so the mouth and the brain are a big starter step before it even gets to the stomach. So when people think digestive issues, they think, oh, it's a stomach problem. But if the mouth is not chewing it well, if we don't have enzymes being produced, if our body's not in a rest and digest parasympathetic state, then we're not going to produce enzymes. We're not going to make sufficient hydrochloric acid. We're going to have these really big molecules that pass through and are not grinded. And then you don't have sufficient chyme, which is a mixture of enzymes and acids mixed with food that helps expel it by the stomach to the small intestines where the nutrients are actually absorbed. So your nutrients aren't necessarily being absorbed in the stomach. It's also why you'll have certain brands of supplements put a specific enteric coating on supplements so that it can reach, those nutrients can reach the small intestine. So it'll say like enteric coated capsule, if that's the case. All right, so we've got ingestion, that's the actual intake of food, secretion, water, acid, buffers, enzymes, mixing and repulsion, digestion, absorption, and defecation, which is the elimination of the leftovers. Digestion starts in the brain, and then the mouth is the gateway, and what we mentioned earlier. So even the sight and smell of food is going to trigger your salivary glands to begin producing saliva. We talked about this way long ago. I don't even remember when, but I always wonder like how chefs deal with this because they're literally around seeing and smelling food 24/7. So I don't know if there's just like they're producing too much saliva or the communication system has been disrupted where they don't produce enough and then they have gut issues. It is interesting when you start paying attention to chefs and they typically have stomach problems. Also probably because they're trying food. It's like gulp, gulp, swallow, not digested. Gut-brain connection. So this is why we created our gut makeover in the way we did, where we included supports for the brain and nervous system. Your gut has its own nervous system. It's sometimes called the second brain. And when the gut is functioning at optimal levels, it'll produce serotonin, which is one of our calming hormones. And when you feel that butterfly in your stomach feeling, that's usually a result of stress. Now, we always think good stress versus bad stress. When you're about to walk down the aisle on your wedding day, you're going to have butterflies in your stomach. That's not necessarily a bad stress, but it's still a stressor. And so in that moment, like you're probably not going to be hungry because you're nervous and your body is not in a place where it can digest food. It's diverting the energy away from digestion to kind of supporting your body in that. Even when I do public speaking events, like I love public speaking. People are always shocked when I say that. I love it. It doesn't mean I don't still get a little bit of butterflies in my stomach and I'm not starving leading up to speaking because your body's directing its attention towards other hormones to produce. So stress is going to be one of the biggest interferences with digestion. It can stop or slow down the movement, even the peristalsis, which is a big trigger for constipation. And then excess stress, that increase in prostaglandins, can also cause ulcers, IBS, IBD, which is diarrhea. IBC would be the constipation counterpart. And this can lead to even long-term things where the digestive system's peristalsis movement no longer works properly. And it can even lead to things like inflammation of the esophagus, which is a reflux situation of esophagitis. Here's how the food is moving through the system. And then you'll notice HCl right there in the bottom right-hand corner. So, and sort of the left-hand side too. So HCl triggers gastrin to be released into the bloodstream. If we don't have sufficient HCl, we won't have sufficient gastrin. Now, very rarely do we even see normal gastrin levels on hardly anyone's blood work. And it's why I don't even think we included it on y'all's, because of all the blood works I've ever looked at with it, hardly anybody has normal gastrin levels. And I think it's a byproduct of our EMF, blue light on our phone. Like even doing this while you're eating or watching TV can shut down that triggering of gastrin, and we're inundated with it 24/7. But HCl triggers that gastrin to be released from the bloodstream, and that and pepsinogen, which is a response from the gastric glands located in the mucosal lining, start to break down those proteins into peptides. So when we even say the word peptides, They're smaller strings of those amino acids. Low HCl is very common because stress is high. So that's ultimately why. If stress goes up, HCl directly goes down, and then gastrin goes down as a result. So here are the roles of hydrochloric acid. It's one of the most important aspects to digestion and protecting the microbiome. The ideal pH of the stomach is different than y'all's urine pH. So when we run your urinary pH, we're wanting it between 6.5 to 7.5. The pH of the stomach is between 1.5 to 3. So that acidity is very important to not only digest and break down your nutrients, but it's so foundational that it's what protects your body and gut from things like parasites. This is why a lot of times when someone finishes up a protocol and we communicate like, hey, really take time to just lower stress, incorporate foundational habits. We're trying to get the body to get back into its normal rhythm and routine, because that alone will prevent parasites from coming back. So if we are constantly just killing the parasites, you're also disrupting the gut flora, and that gut flora also will influence this pH. That is why I think it's a good idea to take breaks and just do foundational things and rebuild the body. A lot of y'all's protocols we even put you on were 30-day protocols. There's a reason we did your follow-up at 45 days, because I think it's important to give your body a break from excess supplementation and eradication in that 15-day window. It's kind of like a reset. It helps your body sort of recalibrate. But very, very, very important. It's hydrochloric acid. And very rarely do we put someone on HCl unless we really see a big need for it in their labs, because you can increase it naturally by lowering stress and bitters and lemon juice and things. All right, so then continuing through the digestive process, chyme is released into the upper part of the small intestine. We'll get to that in a little bit, the duodenum, through the pyloric sphincter. And then after the stomach sort of churns and mixes with the gastric juices, that is how chyme is created, which is very, 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 very acidic. You can see in that picture, like what the chyme is doing and breaking things down. They taught us to think of it like Dawn dish soap or any dish soap. If you have a plate with a bunch of oil on it or food on it, and you're just trying to take a brush with water, you're not going to achieve cleaning it. It'd be like washing your laundry without detergent, which has what? Enzymes to break things down, to, remove stains from your clothes, remove odors from your clothes. And so that Dawn dish soap is sort of like that chyme that comes in order to break down those food particles to be able to clean that plate. All right, so small intestine, as you can see, also a pretty complex process here, but you'll notice the jejunum, the ileum, and the duodenum that make up the small intestine. This is the part where 90% of your digestion and absorption of food takes place. The other 10% would be a little bit in the stomach and the large intestine. So the small intestine has a dual role as both a digestive organ and a gland. The large intestine is more responsible for elimination. So you'll sort of notice it kind of makes a roundabout way around the small intestine and then empties out through that anal canal. It's also called the large bowel. It's where food waste is formed into our poop, stored and excreted. And if you'll notice, even those little circular parts outside, when people are constipated, food will actually wedge itself deep into those areas. And it's like a pipe that has a bunch of debris on it. Things aren't going to pass through as efficiently. And it'll also cause accumulation of foods in that process, because if you're stagnant, it's going to create more stagnation. This is why, like, some of the colonic people will say that there can be built up waste matter for 10 to 20 years in the colon, which is pretty gnarly to think about. And a colonic, unlike an enema, can reach these upper parts instead of just the bottom fourth to really clean out that waste material. Gravity colonics can be especially helpful for people who feel like they're struggling with chronic constipation, or things are just sort of getting stuck or rotting in that area. Really bad gas is a good sign as well. And I do like colonics, yeah. I'm a big fan of them for most people. So here's just kind of a recap of the north to south summary. You have brain, then mouth, bolus, stomach, chyme, liver, gallbladder, pancreas play a role in that, and small intestine where nutrients are absorbed. The remains go to large intestine, and then feces. Large intestine is also a huge place where B12 is absorbed. And if we have things like parasites that are wedging themselves in the little gaps of the large intestine, then that can create a deficiency. Some common causes are going to be stress, poor diet, immune dysfunction, food sensitivities, lack of bile, and lack of HCl. Just as an overarching theme for gut dysfunction, there can be immune things that lead to autoimmune type situations of the gut. And then from a blood work perspective, these are going to be some of the most common indicators. And then also a thing at the bottom of just something to recognize. It is interesting that rosy cheeks can be very common in babies as well, but higher low globulin, higher low protein, higher low creatinine, higher low bun, numerous food sensitivities, low nutrient status, zinc, vitamin A, and magnesium are going to be big, low or high LDH, and then obviously rosy cheeks as well can be a sign of inflammation. So that's sort of poor absorption, leaky gut, stomach distress. And due to the fact that there can be a lot of things that create that imbalance, our supports will vary. If someone starts checking off all the boxes for lack of HCl, then yes, I think adding in some betaine HCl can be helpful. However, if someone has ulcers, then adding more acid is not going to be the best option. So lowering stress will always be one of the top things. Digestive enzymes can be really helpful, especially as you're rebuilding the gut. Gut makeover for the gut-brain connection. Aloe can be really helpful for bacteria. It also supports the bladder, which we'll get to in a bit. Butyrate, ginger, lemon water, chloride. And then from a supplement perspective, we really like Morinda and Illicium. Illicium can bring like warmth and vitality to the stomach and intestines. And Morinda can be really great for ulcers. Addressing infections leading to gut issues, slowing down to chew and breathing while eating, and then avoiding beverages with meals. So if you're drinking a bunch of water with your food, that's going to disrupt the digestive process. And throughout the day, really not great to drink ice cold water. You want your gut to be like a digestive fire. And so if you're eating a lot of cold things, smoothies could kind of fall into this category too. It will disrupt the digestive process. Here's some more nutrients that are necessary for aiding in the breakdown of that food, nourishing the lining, aiding in absorption, things that are needed for chewing, things for blood sugar balance, protein metabolism. So nutrients, very, 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 very important. And I want to ask y'all this real quick before we moving on. Zinc with enhancing smell and improving digestion. With the past few years, what have people lost and what has been a result? Has to do with zinc. Kind of says it on here, but I just want to make this connection before we go on. Anybody?
Also super common with picky eating.
Yes. Yes. So zinc depleted related to smell. So we have COVID that came in and disrupted people's ability to smell. And so if we don't have smelling, not only do we not have enough zinc for the gut lining, but if we can't smell, where did we say digestion starts? The brain. And so people are sitting down, and not only with like long haulers and stuff, can people still not smell very great, but brain fog and chronic fatigue and gut are three of the most common repercussions of symptoms people are experiencing. And it's because if you can't smell, you probably can't digest. And if you can't digest, you're going to be inflamed and there won't be nutrient delivery to be able to be absorbed that's needed for things like ATP production, energy, and brain function. So anyways, body's always communicating signs and symptoms. Also, we know that viruses impact our cells and immune function, and someone could take zinc, but if it's not that they may not need zinc, they may need proper absorption of zinc. So yes, Someone said in the chat, Emily. So PC, enhancing cellular function, calming the nervous system through stress modalities, balancing immune function by supporting our body from a foundational standpoint, instead of just throwing a bunch of zinc at somebody. A few other clinical pearls. So your gut microbiome, as we know, influences brain, immune, other organ functions. And the gut microbiome can be thrown off even due to probiotics. We very rarely use probiotics unless it's for a short targeted amount of time, because too much good flora can still disrupt your other flora. And so the health of your gut microbiome is largely dependent on your diet and lifestyle, the ability to digest, and a wide variety of foods. Glyphosate, this is known to disrupt the gut in a big way, and it displaces glycine. And glycine is needed for a healthy stomach and colon. Big, big, big role that it plays in that. We already talked about gut being the second brain. Metals, these can damage the gut, and the lining of the intestines can be damaged. And then this is another reason we wanted to start a supplement line. So titanium dioxide is a very common filler added to foods, processed foods, and supplements, because it acts as a whitening agent. It makes the supplement look more white. That's literally its only role, which is super frustrating. But it is a massive gut irritant, especially when it's used often. There's also a lot of metals that are added. Think about even the name titanium dioxide and allergens. So these are little things where someone could be like, wait, but I'm taking supplements for my gut to feel better, but they're getting these micro doses of titanium dioxide over time that can irritate the gut and lead to issues down the road. Okay, any questions on gut, stomach, or colon? Castor oil packs on the liver. Because your liver secretes bile, bile helps you digest better. If you digest better, less bloating. Gut Plus from Body Bio and Gut Makeover are different. Gut Plus is going to Gut Plus has tributyric, am I saying that right, Allie?
Tributyrin.
Tributyrin, which feeds good gut flora. Gut Makeover is unlike butyrate and Gut Plus because it works on the gut-brain axis, helps lower stress, dispel gas, and calm intestinal inflammation. So they're working in different ways. They complement each other really well, either Gut Plus and butyrate with Gut Makeover.
There's Jess Kane did a really good, it was either, I think it was on Body Bio's Instagram, but she literally did a breakdown video to say, what is the difference between Gut Plus and sodium butyrate? Because a lot of people can still get confused. They're essentially very, very similar, but the Gut Plus will have a more prebiotic function versus the sodium butyrate not having that, but it's still it's tributyrin versus a butyric acid. So it's derived from the same thing, butyrate. It's just different forms of it. And so you can take both at the same time. You want to separate them, but the difference and benefit for some people is Gut Plus is only 1 capsule a day and it's less smelly. But if you open it up and taste it, or you open it up and smell it, I promise you it is just as smelly. So don't do that. But you'll notice, like, if you take the sodium butyrate capsule and hold it, like, it'll even make your hand smell. So you definitely can take both. You just want to take them away from each other, or you can choose one or the other.
Yeah. I feel like the combo, Gut Makeover and either Gut Plus or butyrate combo is a good combo.
Yeah, I personally take all three. I mean, I was taking Gut Plus during the day at lunch. I take sodium butyrate before bed, and then I take a Gut Plus at lunch and dinner. I mean, sorry, Gut Makeover.
Yeah. Good complements of each other.
Yeah.
Okay, so we'll go into bladder. I'm going to start with the videos and some common causes of bladder. So I'm going to switch to the video as the new screen share.
Can I ask a real quick question before you move on?
Sure.
I know this is like a loaded question. I don't know why I've never asked it before, but I feel like every single like issue is the first thing is like lower stress. But if you're like me and you're just naturally like a high strung worry wart type of a person, I feel like I've gotten better, but I know that I just struggle with like internalizing whatever it is that's going on. I was helping organize for the daddy daughter dance, like helping raise funds, and my stomach was like like wound up. Like I just do that. So would you say like stress control or like start doing breathing? Like what is the one tip you would give for someone that doesn't tend to like easily lower stress?
You've got to offset it. And so two things, sitting down and figuring out why am I this way is important, because we have tendencies, and often it can be, like I said in the beginning, something from our past that has us in those tendencies. Yeah, like digging really deep to figure out why it is the way that it is. It's just a response, right? Often it comes down to an underlying fear at the root of it. And so digging deep and getting to the root, this is where I think counsel and therapy can be helpful and talking about things. And then the other aspect is to offset it with other things. So boundaries is big, time off social media, deep breathing, prioritizing sleep, eating good food, slowing down to eat, exposing eyes to sun in the morning, grounding, being in nature, right? Like all healthy vacations, time off work. Because the other thing is there's people with very stressful jobs, like where they're putting their life on the line every single day and they still digest well because it's how they manage the stress. So it's not the stress, it's how the body manages it.
It's your reaction life, which is a very deep question to ask. I think like going into like, why are you triggered by something? You know, like, why are you triggered by this action of someone else or the job that you're doing?
I know I tend to be, I feel like part of my problem in my Christian walk is like because I was raised with like some trauma and like parenthood stuff where I felt like I was kind of the adult, and I'm still the adult, but I feel like it's not easy for me to like pray first and like sit on something. I just go into like problem solver mode like instantly.
I know.
And so I don't know how to turn that off.
Well, that's where you start, is why do I feel the need to go into problem solver mode? And it takes time. This is not something you can just like, oh, I'm gonna get off this call and do it. It's like a really deep dive and assessment of why it is that way. So for a lot of people, even you saying that, it's the need to control.
Yeah. Well, I think like another common thing that I've realized in myself too, oftentimes, is like being misunderstood or not being heard, like not being recognized. Like that is a very huge component for a lot of people. It's like, why do you feel the need to like prove something? Or why are you problem solving so hard? Is it because you feel like no one's listening? Is it because you feel like someone's not recognizing your efforts? Is it because you need that gratification from some like outside stimulation? So I think there's a lot to it. It's going to be different for every single person, but why do you need to be the problem solver is a big
I think for me, I think it was like survivor issues. Like, I feel like it was a survival instinct type thing. Like if it was going to be done, it had to be me, like I had to make it happen. So I don't know. I wish I could figure out. I know that when I do Bible studies, I always come back to that, like God is actually in control and I'm not. And so if I could just like, if my first solution instead of my 10th option was to go to prayer first, I think that would be like, obviously the thing, but I haven't like committed it to have it yet.
I know, it just takes time. Liv, if y'all were on Liv and I's webinar, she brought this up and maybe some of y'all will connect with it, but she was like, I, for the longest time, couldn't figure out why I felt the need to clear my plate. We'd sit down for dinner and I would be past the point of being full, but I'd feel the need to clear my plate. And so you can try all day long to have discipline on, I'm going to stop when I'm full, but she had to dig deep and realize, wait a second, I was raised with 5 other siblings. And if we didn't eat our food fast, like there wouldn't be seconds. And so there was this like scarcity tendency of like, I don't know if I'm going to even be able to go have that second slice of pizza. And so it's just like, let me eat everything now because I don't know what I'm going to have next. And it took her getting to that place and healing that place of her past to not deal with it now. So often we have to go back. We have to go back in time of why we respond. And a big discovery for me the past few years is what I try to figure out on my own. And that's my first go-to is where I trust God the least. That was a big discovery for me. So trust, doubt, all those things I think we have to explore. But good question. Okay, so with the bladder, I'm going to play this. Let me know if y'all can hear it.
Different types of trauma can contribute to pelvic floor dysfunction. It can be physical trauma, it can be emotional trauma, it can be, sexual trauma, it just depends how you hold tension in your body. If you hold tension like this in your body, it's very likely that you're holding tension in your pelvic floor muscles as well. So there's a study on women. They were shown a sexually threatening movie. What they found was there was an increase in their upper trapezius tightness and shoulders. So, those muscles that do that, and that tightness, and a tightness in the pelvic floor muscles. Let's kind of sit and digest that a little bit. Think about how often, maybe in a threatening situation or a scary situation, do you do this? And know that your pelvic floor muscles do the same thing. So if you're holding a lot of tension in your pelvic floor, those muscles are probably overshortened, right? And they're not going to be able to work properly to close the holes and prevent the urine from leaking. So some of my recommendations, when I see patients that have experienced some type of trauma or have PTSD, is I work very closely with a mental health team. I like to work with the bottom-up processing, because bottom-up processing deals with, sensations in the body, processing the trauma through sensations in your body. Top-down processing is more processing trauma by talking about it, thinking about it, and talking about it and processing it that way. My colleagues take a bottom-up approach. And so there are different avenues that you can explore with respect to the bottom-up approach for mental health. There's EMDR, and that stands for Mind Movement Desensitization and Reprocessing. There's somatic experiencing. And those are just a few things to look for in a mental health provider to treat trauma. So if you've been through any traumatic experience, be it emotional or physical, sexual, I would seek the help of a mental health provider in conjunction with working with a pelvic floor physical therapist.
Okay, so very short video, but just kind of making that connection. I think with pelvic floor, there's such an emphasis on like the actual pelvic floor exercises, but there's a lot more to it. And this sort of gets into what is the next screen share, which is different dysfunctions of the bladder. Wait, I don't think I just shared the right thing. There we go. And there can be a lot of things. So we have incontinence. So the bladder can be either overactive, underactive, feeling the need to always pee, feeling like when you pee, not all of it gets released. PTSD can play a massive role in this. So this is post-traumatic stress disorder, generally associated with things like nervousness, anxiety, nightmares. It can cause sweating, trouble breathing, and urinary accidents. So y'all are familiar with trauma. It's reported that 70% of people in 24 countries have experienced a traumatic event, and around 30% have experienced as many as 4 traumatic events in their lifetime. There's the chart off to the right, which is sort of the same thing in these bullet points of one of many things, and sometimes beyond our control and heartbreaking in a lot of ways, that are causes of trauma. Even if you were in a car accident as a young kid, the body will respond where even if you're in a car, you naturally start to have your shoulders go up towards your ears and hold tension because of the memory. My grandpa, like now when he drives, it's never the same after a car accident. It's just like very much on edge. Okay, so more into PTSD, and then found that women diagnosed with PTSD, 45% reported incontinence, 23% reported stress urinary incontinence, 23% reported urge incontinence, 35% reported bedwetting. Then there's short term, which can be around 6 months, and ongoing chronic, which usually lasts more than a year. And PTSD gets demonized a lot, but I think we have to ask, like, why is that showing up to begin with? One, it's your body attempting to keep you alive. So after traumatic and life-threatening situations, that fight or flight response is activated, and you are more quickly and more likely to survive, especially when you're in a trigger type situation. And then changes in the hippocampus. We talked about the brain last week. And so your hippocampus, when we talked about that, is the part of the brain responsible for memories and emotions. And the hippocampus can shrink with trauma due to anxiety, due to fear. And that can influence the way that we process trauma, how our organs function. The PTSD symptoms can be re-experiencing the symptoms through flashbacks, nightmares, avoiding event reminders. So like on a personal level, my stepdad every year, on Christmas, on holidays, on Morgan's birthday, my stepsister, he has a flare in PTSD because it's that reminder that she's no longer with us. In the same token, when we lose someone in our life to suicide, it triggers his PTSD. When people ask him about suicide, it triggers PTSD. And it's an ongoing process of daily surrender because it's hard, right? These things are difficult. Experiencing angry outbursts, inability to sleep, having issues recalling events. And so a few of you guys, I've had conversations with in consults, and I've asked you to recall memories from certain seasons of your life. I will sit there and feel pressed to ask you about, hey, tell me about elementary school, or tell me about some of your favorite vacations with your family growing up, or your best memories with your brother or sister at a young age. And oftentimes we can't recall it. There is something in our life that was a traumatic experience that literally blocks our ability to even remember a lot of events and things. So that's another key thing. So PTSD is something that occurs after trauma. That fight or flight is activated. It increases the hormone adrenaline, and then the heart rate goes up, which increases blood flow. That increased blood flow is what causes the kidneys to filter more blood. So this is also why when people are super stressed, they are like, I gotta go pee all the time. Now, this does not include pregnancy because your bladder is kind of being impacted and squished a little bit from everything expanding and growing. But there's also a lot of bladder control loss, and why pelvic floor exercises are so helpful during pregnancy due to what's taking place, which is why I think that adding in pelvic floor work before, during, and after pregnancy is so incredibly important. We also have to remember what's happening in the pelvic floor with birth and post-birth, and regaining those controls, especially from a traumatic birthing experience. All of that can play a role. C-sections, these are big. I don't know if Jennifer's on the call, but she introduced me to neural therapy. And so our body, through that C-section scar, can remember these events, and neural therapy can go in and put a procaine injection in that scar and help with better bladder control. So here's just like from this random website, their suggestions. They have seeing a therapist, support in general, relaxation. They put visit your healthcare provider, and doing pelvic floor exercises. I think therapy, counseling, finding support, going back to our nervous system talk, all of that is going to be really helpful with that. Okay, so diving into the bladder more, you have the males on the left and the females on the right. So we did sort of the uterus and the reproductive organs last week. You'll notice that the bladder sort of sits right on those areas. And it's part of your urinary system. So your urinary system is your kidneys, urethras, bladder, and urethra. This system filters blood, removes waste and excess water. This waste is what ultimately becomes our urine. A urinalysis can give you great insight into what's happening with the bladder, unless it is overconcentrated with fluids, and then you can't get the best view. I would love if the first urine in the morning, that first pee, was what is tested in y'all's blood work. But if you're like me, you have to pee when you wake up, and the idea of holding that urine until your lab visit is a little bit challenging. But if you could maybe pee half and then stop, that initial pee in the morning is probably the best measurement instead of drinking water and then going to the lab of what's going on in the urinary system. Most bladders can hold up to 2 cups of urine at a time. I think someone here said that had a small bladder your entire life. So yes, the bladder size can vary, but I do think that there's a lot of other factors in this. I'll give you my real biological dad, for example. He used to not be able to hold his bladder at all. And he would have a little bit of water and immediately have to go pee. He's like, wow, I have the smallest bladder in the world. And once he fixed his kidneys and his gut and dealt with just some emotional things, he now has no problem. He can hold his bladder for hours. He doesn't pee as often. So I do think the bladder can be influenced by trauma and organ stress in other areas. Also, you have to remember it's a detox organ. If your body's trying to eliminate things, go back to people having to pee in the middle of the night when they're living in mold, the body's like, I need to get this out. Hormones are influenced as a result. All right, so urine flows from the kidneys to the bladder through two thin tubes of the muscles called the ureters, one on each side of the bladder. Your bladder is what stores your urine, obviously, and they're part of the urinary tract. So you can refer back to even the kidney PDF for more info on kidneys. Supporting the kidneys often also helps support the bladder. A CBH can show urinary issues and also, what's the word they use? Do you know what I'm thinking of, Allie?
Yeah, it's the one that I'm always like, what is that again? Hold on, I just had actually this other one open up. Here you go.
I can't think of the name.
Hair balance health test. Integumentary?
Yes, that's the other system.
Which is the skin, right?
Yes.
So that's so interesting because I was like, I have good skin. I'm an esthetician. And you were like, do you sweat? And I said, no, I never sweat. And you're like, yeah, that's a problem. Like, that's a detox issue.
Yep.
I remember.
It is. Yep. And I don't think that a UTI should always get antibiotics. There's a really fascinating podcast that I was listening to earlier, and they were talking about UTIs over and over again and how biofilms play a massive role in this, where people just continue getting them, because we have to remember that spirochetes and bacteria, especially in the urinary tract, will bury themselves within biofilms, which are antibiotic resistant. So what it does is the ones that are outside of the biofilms, that antibiotic goes and wipes that out, which also wipes out all the good flora in the bladder and in the vaginal area. And then those biofilms start to leak out more of the bacteria. And then we have another random UTI, or hormones shift and histamine goes up. And all of a sudden we have another random UTI. But typically chronic UTIs come back to some sort of trauma as well, which connects to the bladder and the idea that it's it's an organ that holds a lot of trauma. All right, so what's in your pee? There was a study that took 7 years. They found that at least 3,079 compounds can be detected in the urine. 72 of them are made by bacteria, while 1,453 actually come from the body itself. The other 2,000 plus come from diet, drugs, cosmetics, or environmental exposures. Some compounds belong to more than one group. So your urine is an aqueous solution of greater than 95% water, and then there are remaining constituents in order of decreasing concentration, so urea. So we look at y'all's uric acid as well. It's why a too low or too high uric acid can also point to long-term, long-withstanding chronic issues in the urinary tract and bladder. There's also blood sugar involved, chloride, sodium, potassium, creatinine. So when we look at y'all's electrolyte markers and we look at something like chloride, there is a high concentration of chloride that's made up in the urine outside of urea. When someone is stressed, they're going to pee out more chloride, and then there's less in the blood, which is a stress response. Same thing goes for our sodium and potassium when it comes to like cellular communication and cellular hydration, which needs things like PC. Okay, here are some of the bacterias for the urinary bladder connection. So Pseudomonas is a super common one I see. This is a gram-negative bacteria. It totally depletes phosphatidylcholine in the body. So if you've ever run a SpectraCell and you see lower end choline levels, Pseudomonas is a key thing for that. It'll also deplete zinc. Lyme is sort of in the same boat. It depletes choline and zinc a lot. Then you have your group A and group B strep. Most people think of strep throat, but this can also cause urinary tract problems. It can cause sores in the urinary tract, blood and skin infections, pneumonia. You've got some other gram-negative bacteria. Some are rod-shaped, some are non-spore forming. And yes, so
The main reason why I think the slide is interesting and why I wanted to include some of these specifics is I remember it was a kind of this aha weird moment when I was going through RWS and they teach the GI map. And it was really, really common to find the connection between the bacteria in the gut and the stool test as it relates to people who have chronic UTIs. And you just wouldn't normally think oh, chronic UTI and a stool test, how does that even correlate? But it was very, very common that if these people had specific of these bacteria in an overgrowth, that they were experiencing chronic UTIs. And so by getting rid of the bacteria actually solved the UTI issue, which goes back to Emily's point of no, you don't necessarily need always antibiotics, but that's why the antibiotic in part would work sometimes to clear the urinary tract infection, because it's actually clearing it out of the gut and then therefore out of the urinary tract infection or in urinary system.
Yep. And then also a lot of these bladder issues that stem from these can also lead to skin problems. So when someone keeps just trying to take nutrients that support the skin, if there is fungal or yeast or other bacterial issues that are impacting the bladder, that can also come through the skin as well. You'll notice on here a lot of blood and skin infections that take place with these, and they can reside in the urinary tract. Infections are going to be a big one. And the reason why is when you have an infection of any type, your body's going to produce fibrin. That fibrin goes into, keyword here, biofilms. The biofilms are the protective barriers. They wall off the infection. They make it to where you take an herbal or antimicrobial and it just kind of bounces off the wall. It cannot get to that infection, and a lot can reside in the bladder along the urinary tract. And the end result of that is a chronic infection because they're BFFs with their neighbors. And so they procreate, and then they have a neighbor build a house, and now you have 2 chronic infection loads, and it just keeps growing and growing and growing and growing. And that's why it can sometimes be a straw that breaks a camel's back, whether that's COVID or something in life where all of a sudden they were feeling great and now they're dealing with chronic illness and they didn't even know about it prior. A lot of people are walking around with this and have no clue. So maybe the body has done its job in walling it off sufficiently, right? Biofilms aren't bad. They can be protective. And it's not going to be a problem, but in overgrowing situations or when they're immune compromised, that bacteria within the biofilm can still reproduce slowly over time. It'll spill out, and then people begin to have things happen like bladder problems, bladder issues. EMF is a big one. EMF causes cellular hydration or dehydration. Anytime the body's dehydrated, you're going to have bladder problems. End of the day. So having minerals, drinking enough water, being mindful of Wi-Fi, all those things are really important. Some people have to avoid high oxalate foods. We tend to have y'all do that when we're addressing metals and molds, because high oxalates are going to create high oxalates, and that is going to cause bladder problems. Mast cells are kind of in that category as well. Parasites, mold, chemicals, metals, those all play a role as well. Too high doses of vitamin C, especially from ascorbic acid, that can cause a bladder flare in a lot of people. And then Dr. Klinghardt said even too, many Lyme patients have undiagnosed kidney problems since the inner lining of the kidney, urethers, bladder, and urethra are hiding places of Lyme and co-infections. There's been a few other people who have also said the bladder can be an area where things like Bartonella will go, and the spirochetes will drive themselves, or I think of PCOS, the spirochetes will drive themselves, create biofilms and cysts, and then we have them slowly leaking out and causing problems. And then scars, we mentioned that earlier. So appendix surgery, stomach surgery, C-sections, those scars can disrupt the flow and create bladder problems. Another little thing with Borrelia, this is from the Klinghardt Institute. So the kidney and bladder are the highest concentration of tissue spirochetes, and symptoms can include, notice that it says interstitial cystitis is a symptom, not a root cause. It is a symptom of something deeper. Prostatitis, babesia, can also be involved in that. Sexual dysfunction, trauma could be involved with that. Loss of libido, trauma can be involved with that. Shame that has to do with all of those things. Pelvic floor disorders, pelvic pain, menstrual disorders, filtration problems. So when we look at the specific gravity of the urine, right, we need that in a delicate balance. And yes, after intercourse too, spirochetes are attracted during that to the urethra, which can cause acute inflammation as well. Here's another problem with cell phones, right? Like we have to remember that these were not part of our ancestors' day to day. And even when phones got created, people were not holding them or away from their phone. We're all guilty of this, every single one of us. And I think it's why we have to be so mindful of not putting our phone in pockets. Men are going to have to be more mindful of that, especially with how close that is to very important areas that are needed for procreation. But this was a study done, I think, back in 2014, and it said intensive use, notice intensive, so it's all about duration and dose, of mobile phones has negative impact on bladder tissue as well as the other organs. Keeping a minimum level of mobile phone use makes it easy to be kept under control of disease in which inflammation is a factor. They have shown that EMF can increase bacterial overgrowth, that it can wake up dormant viral loads. And so I think having healthy boundaries around the cell phone and time away from it is incredibly, incredibly, incredibly important. Keeping it on airplane mode or turning off Bluetooth and Wi-Fi when applicable. I always say when you're using your computer, do not use it while it's plugged in. If you're on your phone, do not use it while it's plugged in. All of that EMF and radiation is amplified. And so avoid that at pretty much all costs. So especially in the car, people will plug their phone in. When you're in the car, it's also a heightened EMF. And so people have their phone plugged in, they're holding it, and they're also on the road, and it's like an EMF disaster, which is why a lot of people don't feel great on road trips or after driving to a farther location. Here is 2 other studies with trauma. So the effect of chronic psychological stress, coming back to stress, on the function of the lower urinary tract. So this was an animal model. This was a study that was released March of 2022. And it said chronic psychological stress can impact lower urinary tract function, abbreviated LUT, with or without pathological consequences. This study provided a comprehensive overview of stress-related animal models for the study of lower urinary tract disorder and summarized the compensatory mechanisms underlying the emergences. So they said variations in stress duration, right? Some stress is okay. An intense workout in the right time of the month is okay. So duration, the nature of the chronic stressor, the differences in even the species, the strains, the sex. We know that naturally men are better at managing stress than women. In the childbearing years, a female needs to prioritize rest because you are able to bring life into the world. And because you're able to bring life into the world, there has to be boundaries established around commitments and work. And it goes against everything culture has created of like the hustle, the grind, the needing to work and be a stay-at-home mom and be responsible for tons of extracurricular activities. You have the ability to set guidelines and go about your life in a way that does not lead to stressors. But they did this animal model study and found that basically there was the connection between psychological stressors and the function of the urinary tract, and then that ultimately causing and leading to functional bladder disorders. And then the one on the right was the impact that childhood and recent traumatic events on the clinical perspectives of an overactive bladder. So the results section of this, I want to read that in addition to the conclusion. Childhood sexual trauma was more prevalent in patients with overactive bladder compared to controls. That's significant, 29.4% versus 6.7%. That's a big, big, big difference. That's more than 25%, 1 in 4. Overactive bladder patients also rated their child, and this is like heartbreaking, right? Like I don't want to dismiss that. This is heartbreaking. There's healing for it, and recognition and talking through it, I think, is just so important, right? Rated their childhood sexual exposure as more traumatic compared to controls. There was no difference in deaths or parental upheaval, illness, injury, traumatic events between overactive bladder and control subjects. And then childhood trauma predicted worse bladder pain, worse urological pain, poorer mood, higher anxiety, higher physical symptom burden, and higher psychological stress. So 30% of overactive bladder patients reported childhood sexual trauma. So that's almost 1 in 3 of people with overactive bladders. Again, when we use the word stress, it's sort of like all encompassing. Here's another really fascinating thing. We've been talking about vitamin D a lot and how COVID has sort of disrupted the vitamin D receptor sites, the VDR. There are certain people where I'm always in the camp of some people may need to supplement with vitamin D because they may have a genetic predisposition to not absorb it enough from the sun. So the bladder wall needs sufficient vitamin A to produce certain peptides. These prevent urinary tract infections. And a lot of times when I run blood work and someone has symptoms of a urinary tract infection, their vitamin D is very low. So if someone has a vitamin D receptor mutation and they are making vitamin D as well as everybody else who goes out in the sunlight, preferably without sunscreen, 10 to 15 minutes a day, it will block, that mutation will block the production of vitamin D. It'll block it by 87%. So yes, we need sun exposure without sunscreen on parts of our body. I always say put SPF on your face, but that's just me. If you don't want a really leathered face when you get older, I would recommend SPF on your face. In order to make
cancer.
What?
I said, or skin cancer on your nose, because
Yes.
I
Yes.
wear a hat religiously, but
Yeah.
you don't realize, even if you're wearing a baseball cap and you're turned to the side and you're saying, like, I had skin cancer taken off my nose last year. Oh,
Yep.
and we were talking about this M&I on the top of your hands, driving, pushing a stroller. I also just had something taken off my hand here.
Yeah.
Super
So use sunscreen, but like on the main parts of your body, like when you're going for walks, like use a tank top if it's hot out, as we get into these summer months, because having it on multiple areas of the skin that don't have sunscreen, at least for the first 15 minutes, is really important. However, people that carry VDR, their body cannot hold on to and make that vitamin D from the sun. It's a receptor problem. So many times, and this was a doctor that was talking about this, and I see it too, vitamin D is low with bladder and urinary tract problems. So it's not a bad idea to, in my opinion, and if you're worried about lowering magnesium, add in magnesium with it, supplement with vitamin D. Even when all the stuff came out online of vitamin D supplementation's bad, I still took it. I've taken it from the beginning because I'm like, I know how I feel. I know what it does to my labs. I've run the 125 OH form. It's not causing a problem. And this is where like crowding out the noise of people demonizing things as bad. It might be bad for some people. For some people, adding in vitamin D can be life-changing, especially when it comes to urinary and bladder and kidney problems and hormones and thyroid and all the things. So indicators for bladder and kidneys. Oxalates, we talked about that. High or low bun, high or low creatinine, EGFR could kind of be grouped into that as well. If a culture is run, an abnormal urinalysis, but that'll only show if it's an active infection. It won't necessarily show what's not coming out in the urine. This is very interesting. Sinus headaches, clogged sinuses. Your sinuses are not the problem. Yes, we can, rinse them out with rinses and nasal sprays, but when they get clogged, it's communicating your other detox organs are not working well. So when your kidneys aren't filtering well, when your bladder's not working well, when you're not eliminating properly through the stool, you can begin to have sinus inflammation, stagnation, and sinus headaches. Typically too, when you see chronic bladder problems, you tend to also see endometriosis, which is also, I've talked about this before, anecdotally, I've noticed huge with sexual trauma past or insecurities in their past. So endometriosis, PCOS, very common with people with bladder issues because they're not making enough progesterone to balance the estrogen. And then low vitamin D. And then in a more acidic urine, this is going to favor the growth of E. coli. So E. coli is what they say 90% of people with UTIs have. Again, you don't just want to treat the E. coli or you're going to be treating it forever. You want to create a balanced alkaline versus acidic urine that does not favor the growth. It's similar to HCl in the stomach. You want sufficient HCl by lowering stress so that a insufficient pH does not favor the growth of things like parasites and bacteria. Again, foundational help. So addressing the infections and trauma emotions is going to be important for the bladder. I would weigh even more on the trauma and emotional side as a big thing. Optimizing vitamin D levels, uva ursi, D-mannose, drainage essentials, medicinal mushrooms, ornithine. Ornithine is what we've had some of y'all take due to excess ammonia, which can happen from detoxing parasites, especially around the full moon, which can lead to insomnia. You'll notice that you almost smell like excess ammonia, and ornithine can help mop up that ammonia, which will decrease the amount of stress placed on the bladder. Because anytime there's excess ammonia, the bladder is going to be compromised. So that can be helpful for that. Echinacea, because of the immune function. Golden thread and Schisandra, we've had a lot of our new group on that combo, and it's worked really well for like fungus and yeast. Morinda, this is one of our favorites for parasites, but also great for the bladder. Saw palmetto, reishi, both of those are also great for PCOS, endo, magnesium, takisumi, and raw virgin coconut oil. Going back to the chat, how to know if you have a receptor problem. You can run a genetic test, and if it shows a VDR mutation, then those are people that typically need supplemental vitamin D, and you want to take it with vitamins A and vitamin K. That helps with better absorption. So vitamin D, it gets converted to hormones, but I honestly think it's fine to supplement for most people. As long as you're not overdoing it and you keep your magnesium in check, it's not necessarily a problem. Yeah, chronically low vitamin D, even though you're supplementing, can be an indicator. Yeah, like Ali said. All right, so what do you do if you have an infection? Here are some of my favorites. Homeopathy can be extremely helpful for infections because they work in a very acute manner. So for UTI and bladder infections, you really want the 200C form, not the 30C form. Sometimes you'll see it as CK, 200CK. So you have different options, whether it's UTI, bladder, or yeast infections. And then herbals. What's really helped, and I've had several people come back from Mexico with a lot of bladder and UTI infections because of the bacteria there. The combo of these four have worked really well. Fulvic 400X, that's from Mother Earth Labs, several dropperfuls every few hours. Uva ursi, 2 to 4 drainage essentials, and D-mannose. And then I love ozone vaginal insufflations. That has helped a lot of people with ongoing recurring bladder, yeast, or UTI problems, probably because it gets rid of that bacteria and biofilms, because ozone is also a biofilm disruptor, and it reaches it. Those other nutrients, though I love them, they have to go past the stomach. They have to go past the intestines before they even reach the bladder, kidneys, urinary tract, all that. And then we'll end with just some common things. Sorry if y'all are hearing screaming in the background. I think kids are playing outside. Some common things that are correlated when we have imbalances in stomach, intestines, bladder. So bloating is going to be a big one that is an outward expression of something deeper going on. So stress, big trigger, big factor. Fungal overgrowth, lack of stomach acid. Food intolerances or sensitivities. And this is foods that some people I know rave about and love, but not everyone can deal with raw milk. They don't have the enzymes to break it down. Not everyone can handle eggs. A lot of people cannot handle gluten and its glyphosate counterparts. Some people don't do great with excess nuts and seeds. They can be very harmful on the digestive tract. Things like kale, very hard on the digestive tract. So those can all play a role. Bloating can be a common symptom of PMS. A little bit of bloating normal, but if it's excessive, if it's extreme, if it doesn't restabilize, that can show hormonal imbalances. Eating too quickly, not chewing food well, you're also going to increase the amount of air you swallow when you do that. That can lead to a buildup of gas in the stomach that causes bloating. And conditions like IBS or celiac I think that should be celiac, not celiac. Peptic ulcers that can also cause bloating as well. So another little slide on low stomach acid. All right, so Emily Scrolly, you're going to love this slide. When people have low stomach acid, they naturally avoid meat. Why? Because avoiding meat decreases bloating, because it takes stomach acid to digest meat. And so if we do not have enough HCl, we are not going to digest protein properly. Avoiding meat, though, is the Band-Aid. And so people will get off meat and say, wow, I have less bloating, I have fewer digestive complaints, but the meat's not the problem. The problem is low stomach acid that stems from stress. And so that reverse way goes back to lowering stress levels to increase stomach acid, eating a whole foods nutrient dense diet, slowing down, parasympathetic nervous system support, vagus nerve support, so that we can begin to digest our meat. Cramping, heartburn, nausea, acid reflux, bloating, those are all symptoms of low stomach acid. You might experience tenderness over the belly as well. And then recurring H. pylori, recurring SIBO, recurring C. diff, or if those just keep popping up over time. You also need B vitamins and zinc to be able to produce hydrochloric acid. So if we have immune dysfunction and leaky gut, we're going to use up more of our zinc. Then we'll see a low ALK phos level. Same thing with B vitamins. We see low ALT, low GGT. You need those B vitamins to be able to produce HCl. There's also a lot of B vitamins in meat, but you need stomach acid to be able to absorb it. And unfortunately, a lot of our meat nowadays, because they're eating grass that has herbicides and pesticides, those compete with these nutrients. And so if we are eating meat products that have less nutrients in them and we are only absorbing some of them, we are now deficient despite a wide diverse diet, which is why I do think supplementation has its role in place in the world of health. Your hair, your bones, your nails, your teeth, all of these can be outward examples of something going on deeper. So if we cannot digest our proteins and our minerals, we're going to have a lot of wrinkles surface, premature aging. We're going to have brittle bones or feeling like we have a lot of teeth sensitivity, gum issues, brittle nails or hair, or weak hair and weak nails, because we need things like calcium, magnesium, iron, B vitamins that are all related to low stomach acid. So someone could do the HCl challenge. We've talked about it in the past. You get some good old-fashioned betaine HCl. You're a few bites into your meal with protein and fat, and you take one. You're trying to feel a burning sensation. If you don't feel the burning sensation, then next meal with protein and fat, you take 2. If you don't feel it, next meal with protein and fat, you take 3. And you keep going up until you hit 6. Now, if you hit 6 and you don't still feel, if you don't feel that burning or warming sensation, you got to stay at 6 for a while. You are completely depleted pretty much in HCl. Now, when you feel the burning, you back down 1. So if you felt it at 5, your next meal, you're going to take 4. And you'll take 4 with every meal until you feel warming or burning. Then once you feel burning, however long it takes at 4, you back down to 3. And you're retraining your body how to make HCl to where you eventually do not need it anymore. And you don't want to take it before the meal. You really want to take it during. So a few bites into it. All right, IBS. IBS is a diagnosis for there's something going on and we don't know what it is. And so when people get an IBS diagnosis, it's a doctor saying we don't know what's going on. So it can be caused from food sensitivities. It could be a result of things like candida, bacteria, parasite overgrowth, unaddressed trauma. It can be a result of that. It can be due to mold mycotoxins, and it can be due to mast cells. Those are just some of the many things that can create irritable bowels, irritable bowel syndrome. GERD. This is very, very, very common, especially in our parents' generation, and their solution is Tums for this, or an antacid, which is completely not what's needed. So GERD, and I learned a lot about GERD because my practicum and internship in college was at a hospital, and we worked with newborns and those up to the age of 3. And so one of the most common reasons we would go into one of the visits with a parent was GERD, or failure to thrive, FTT. And it pained me. And it's largely why I got out of the registered dietitian program. What was recommended to these little babies due to GERD? I mean, awful, absolutely awful. But GERD is often called heartburn or acid indigestion, or reflux is another name. And essentially what's happening is between the bottom of your throat, which is the esophagus, and your stomach, you have a valve. It's abbreviated LES, and it should open to let food go into the stomach, and it should close to prevent the contents of the stomach flowing back up. We talked about that in the very beginning. In GERD, the valve is weak. It relaxes at the wrong times. It closes at the wrong times. People that have a hard time swallowing, this could be a result as well, which allows the stomach contents, partially digested food mixed with stomach acid and bile, to flow back into the esophagus, the bottom of the throat. This is what creates that feeling of heartburn. A burning pain. It begins at your breastbone and it moves up towards your neck and throat. So sometimes people feel like my heart is actually burning, and it's because of where that's located. Sometimes people will feel like, oh, my food's coming back up, or I'm burping a lot, I'm belching a lot after meals. There's a bitter aftertaste, acid type response after meals, and it can last around 2 hours after eating. A really good way to know if it is an acid problem is to actually make a beverage with baking soda, sodium bicarbonate, because that will help neutralize the acid. Now, that's not a long-term solution, but that is basically showing you that there is a valve weakness. There is an acidic imbalance. Sometimes in extreme cases, people will feel chest pain or pressure, abdominal pain, a cough as well. 2 biggest contributors to GERD is diet and lifestyle. If someone's stressed, they're not going to digest well, that valve's not going to perform properly. We have GERD. Even in babies, if their diet is not optimal or the breast milk that they're receiving is coming from food sensitivities of baby or mom, it can create this instability of pH. Infections are going to play a role. Candida, go back to the stomach, rosy cheeks, pathogenic overgrowth, bacteria, all those things are going to play a role. And then these are the foods that are sort of the heartburn triggers. So excess citrus fruits, someone has an ulcer, a ton of acidic foods, probably not going to be great. Tomatoes and peppers, big triggers for heartburn. Onions and garlic can be problematic for some. And then if someone is not digesting well, and they are not making enough stomach acid or bile, even foods that are high in fat, because fat takes longer to digest, that's going to disrupt their blood sugar, because it's going to, again, when you're sleeping, you're going to have poor deep and REM sleep because your body's trying to digest this fat, and you're laying down horizontally, which is already disrupting the process, especially if it's too close to bedtime, and it's diverting energy away from proper hormone production and sleep to the digestion of this. Fried foods, alcohol, fizzy drinks. So yes, I do love me some fizzy drinks, but fizzy drinks can be a trigger for heartburn, and they can disrupt things because think about it, it's bubbles, right? So you're swallowing air, you're going to disrupt the normal process. So I had a girl that would only drink sparkling water, and she had the worst GERD and bloating and acid reflux. Took it out, it balanced out. Caffeine can do the same thing. So a ton of normal coffee, acidic coffee can be a trigger for heartburn, and excess chocolate as well can be a trigger as well. Anything else, Allie, did you think of?
No, I don't think so.
Okay. Any questions on those organ systems? Lots of new info, I feel like.
This was kind of related. I didn't really answer this because I feel like it's too hard to type, but like Becca's question. So the subject of certain people not being able to handle certain things, raw milk should go ultimately for the body to be able to handle them. I mean, yes and no. You know, there's some people who are not going to be, you know, okay with dairy no matter what they do, you know, but I think the point is really to go back to like, you know, what did our ancestors do? How did they prepare it? But going back to that too, is like grains for some people can be a huge trigger, but like back in the day, they were soaking them, they were sprouting them. So it's like, sometimes it has to do with the preparation and like the modern world we live in. But, you know, no, I don't think like gluten, I don't think everybody should be able to, nor are they going to be able to handle gluten. But again, the question could be, well, is it the gluten or is it the glyphosate? You know, so like, it depends on what that food is. I think it's just too hard to say. Yes,
I think that was like my question, like going back to how they prepared it. Obviously, gluten was way different. Milk was way different. And there, I mean, I guess, I don't know if we can really go back to that, but there are like a lot of we sprouted oats or soaking them or whatever. Good quality raw milk. So like, would the goal be to have the body be able to handle properly prepared and good quality things like that instead of, you know, avoiding everything their whole life?
Some people will still have to avoid dairy aside from butter and ghee. That's just the reality. And when you think about it, that milk is coming from a cow that's probably, no matter what they say, grazing with herbicides and pesticides.
Yeah. Especially because of our world now.
Yep. And when people want to say, no, this grass is green, I'm like, okay, what about the chemtrails? What about the rain? What about the water they're using for these pastures, right? Like we're so far from the way our ancestors did anything, you know, like they were, I say this all the time, they were not taking beef liver and putting it into a powder and putting it through machinery and encapsulating it for us to eat. They weren't doing that. And so I see it as a major issue where this whole trend of like ancestral eating, I'm like, we're not eating as our ancestors did because we don't have the available nutrient dense resources to be able to obtain that without all the junk that's been in the mix of it, you know? So that's sort of like, there's just a lot of people where it's going to keep causing them digestive issues and bloating.
Makes
And
sense.
even genetics.
Yeah.
You know, certain foods for certain people genetically are not going to work. If there's, you know, COMT, if there's MTHFR, if there's, I mean, there's 1,000 different things genetically that people could have that would make them less likely to do well or tolerate certain things. That's just reality.
So what I always go back to, and we've talked to y'all about it before, is the pulse test. Your body will communicate it. If you put that raw milk on your tongue, nothing changes in your pulse, but it still causes bloating, then there's something from an enzyme perspective of why you're not handling it well. Not that the food's the problem or the milk's the problem, it's an enzyme problem. But if you put that on your mouth and your pulse goes up, your body's literally saying, this is a no for me. No matter how much gut healing I do, I cannot tolerate quinoa. My pulse jumps up like 12 points. Can't do it. It's like that. It's like my body's like, no, I don't care how great you prepare that quinoa, you cannot do quinoa. So like, you know, at what level are you like, I'm chasing this thing to be able to eat quinoa? It's like, no, I'm just not going to eat quinoa, you know? And brown rice can be the same thing for people because of the outer hull and how it absorbs all that stuff from the environment, which is why I only eat basmati or jasmine white rice. I will not touch brown rice. Will not touch it. And ghee and butter are good for most people because of the way it's processed and how it's removed. So ghee is probably the best. Grass-fed butter can still be good too. Yeah, ghee is good. If it's shelf stable, it's usually a lot easier to handle. So ghee, lard, coconut oil, those are all real good options.
And also, I mean, there's benefits to things like that, like going back to the butyrate piece. Ghee can be, you know, dairy could be potentially problematic for someone. You switch to ghee the way it's prepared, and then you have a good amount of that butyrate in butter and things like that. And then it's beneficial for your body.
Yep. Yep.
I think we kind of got all the questions.
Perfect. I think so too. Next week, we've got either or.
I think the heart and lungs should be next.
Okay, heart and lungs is next week. And then the week after that, we are doing mouth and teeth and gums, oral health.
Yeah.
But next week is lungs and heart. I brought this up at the beginning of the call, but if you hopped on late, y'all have until the last day of April to get all of the stuff downloaded. And in the interim, Allie, I kind of let them know what we're thinking next, rough estimates of what we're wanting to do with the app and things, and how in the meantime, we may have this group specifically in a separate place with like a Google Drive or something along those lines. Y'all will still have access to practice better, but we're probably not going to have this app done right away. It's going to take us some time. So I let them know that.
Cool.
All right.
Did you share any more details on anything or just that?
Just at the beginning, how we're wanting to do an app.
Oh, okay.
It'll probably be like a free downloadable app with a baseline monthly membership and then different tiers. But I said for this group, where it will vary is if we have an option for people to order labs through the app, they would still go through us because those are probably going to be upcharged. So.
Okay, cool. Yeah, I'll put everything, just hopefully you guys are seeing where this is all going, but it's in the all education module. There's like I think it's either all education or maybe there's an organ systems module. I can't remember. So if you're in the November group, I'm going to shut that down probably this week. I kind of kept it longer in case you guys were confused, but making sure everyone is just in the the level 3 platform now, and everything's in there.
Perfect.
I think you guys might have said this, but all of the recordings and everything, I think you said you might be re-recording them for the new app.
We're
Like-
re-recording everything from a compliance standpoint because we can't have on there people's names when we release these videos.
Okay, so as far as anything we're saving, I mean, it's hard to remember what I would want to, but I know some of these calls are like really good. So I just want to know if I should try to save them or just wait until.
I don't know if the calls can be saved, but y'all can go through and like listen to them and like record notes of them, you know, but like legally we have to do that.
Yeah,
So yeah, we cannot upload any of these to the app. And with the new space of what we're creating, there's max capacity and storage. So
And we just don't want it to be on YouTube.
but a lot of this information will be on the new recordings anyways.
to a degree, yeah. Simplified, easy to find, keyword searches, all that.
Okay.
Yeah, if anything, it'll be easier to go through and be like, oh, okay, cool. That was like an hour. I mean, because we talk about all this stuff on these calls. So this call ends up being over an hour, where hopefully we're going to give you like the main chunk of it, the meat of it, in like half the time, if not less, when it comes to the education portion of it, because we're not spending time answering questions and doing announcements and chatting and whatever.
Yeah. And also like really ask yourself, would you go back from calls that don't have descriptions and go watch another 125 past calls? Probably not. No, you're not going to. Neither would anybody else. They'd be super overwhelmed. So that's why
We didn't even do it. Like I couldn't do it. I was like, I'm gonna go back and I'm gonna listen to these and I'm gonna like name them so I could put them and organize them. And I was like, I cannot do this. I cannot. I would pay someone to do this and we couldn't even find anybody to pay.
Yeah. So that's
So yeah.
right.
All
have a
right.
good rest of your week. We'll see y'all next week.
See ya.